Alrighty, before we get started, I just want to say I do have some notes here that I will be looking down at intermittently. And while I talk, sometimes I'll just kind of look off to the side or look up above the camera. It just helps me speak more naturally. Okay, and on that note, let's begin. So for question number one, the concept that I felt that I especially took away after reflection was what hospice care was as a whole. I realized that during the discussion and after reflection, I had a pretty poor understanding of what hospice care actually involved. My understanding was, someone at the end of their life going through the dying process, maybe surrounded by maybe a social worker or maybe a team of late in life medical professionals that may help this person with pain management, obviously provide this person with some grief counseling for any grief or shame or bereavement that they themselves may be going through. But after that assessment, I learned that hospice care is a lot more intricate than that. I realized that it's a lot more about working with families, and I realized that it's a lot more important to figure out what is going to happen with the family system before the time of death of that individual. So I learned, how important hospice is in not only the life of that individual, but the lives of that individual's family, the children in that family, maybe romantic partners that they have, fictive kin, and those type of individuals, and how a lot of that responsibility falls on the social worker to help alleviate those symptoms of grief and bereavement. And of course, that job can be much different depending on what sort of death that individual is facing, whether that be a sudden death or maybe something brought on by a sudden unexpected illness. Okay. For the second question, identify one area of knowledge or skill or a social work value that you became aware of and wanting to explore further. So something that I was really unaware of is just exactly what social workers do in a hospice setting. I don't know, specifically what tasks they might be responsible for and what services they actually, do undertake during their time working with a dying individual and their family. So the point that I found really most entertaining, I guess this sort of segues into question 3. So that was I just really wasn't sure the actual responsibilities of hospice care social workers. So moving on to number 3, the steps that I took to find out this information and the resources I used. The first resource I looked to was our class book here, The Theoretical Perspectives for Direct Social Work Practice. That's hard to read backwards. So I looked through here, I looked for terms such as palliative care, death and dying individuals. I also looked for hospice care, and I was unable to find anything in this book. Just for whatever reason, they didn't have a lot on that issue. A little bit, but not much. So what I did do, I did a couple searches online, and the Social Work Policy Institute is where I got this information from. I read a couple of articles from them and some literature from individuals who have worked with individuals going through the dying process and people who have worked with families experiencing great grief and bereavement. So a couple of the things that I was able to figure out or find out about social workers working in hospice care was how important that they are just exactly to the families. I found out they help advise families about residential alternatives that their family member may need as they go through the dying process, and that could be based off of how much more care they're going to need, what kind of medical issues they may be going through, and what kind of environment would best be suited to handle those issues or deal with those things with the family involved. An example would be somebody, at the end of their life in need of dialysis treatment, if they have a lot of trouble getting to and for to that treatment, it may be a better idea to move them to a more permanent facility where they can receive the treatment that they need without unnecessary due hardship to themselves or their family. Another thing was brokering avenues to financial resources, something I really didn't think about, but of course, whether it's the middle of your life or near the end of your life, money is always going to be a problem or something that you at least worry about. Social workers are really great at connecting families and individuals to financial resources like Medicaid. Medicaid is a great way for individuals to help pay for the end-of-life expenses that they may have, and a good way to help alleviate that financial stress on the lives of their families. Also, social workers are case managers for different providers that the client that's going through the end of that life may have, such as medical professionals, maybe different social workers that they may be involved with in their life, nurses, musical therapists, doctors, physicians, in-home care staff that they may need to keep in contact with, that they themselves are not able to maintain and sustain those resources or connections. That ultimately falls on the social worker to make sure that those connections are kept and that those resources are available for that individual and for that individual's family. And then finally is to provide counseling or just counseling to the dying individual and their families. A lot of these individuals may be going through a very tough time, understandably, maybe dealing with intense feelings of grief and despair. And as I spoke a little bit about on question number 1, how a social worker must react to the individual and that family greatly depends on what kind of death or what kind of situation that family and individual is going through. The practices that a social worker may use will be much different depending on if it may be a sudden death that the family, the individual has already died very suddenly, and now we're coming in and helping this family deal with that grief. It could be from a traumatic death. You can imagine maybe a car accident that other family members were survivors of, but they lost a family member. An unexpected illness, maybe, we can imagine cancer, something like that, an inoperable tumor of some sort. There's also expected passings, maybe from old age, maybe the anticipatory death of maybe a child who was born with something that, has led professionals and family members alike to believe that this child will pass. There's not much that can be done about it, and there are avenues that need to be taken now. So with that, I'd like to move into the 4th question. So what does surprise or interested me most, professionally or personally, during this activity? I think the thing that had the biggest surprise or interest to me personally was just how individuals think about death. Even in our own class, many of us have experience, I guess, in social work or with social work literature, but we all view death very differently. How we believe how we should live our life before our death, and exactly what avenue should be taken for our death, preparing for it, what we want to, have done to our belongings after our passing, and how we want to be remembered, and how we want our family, to act or conduct themselves after our death, related to us and to our death. I just thought it was very interesting. Some people, just have very different takes on that, and whether, you agree with them or not, your job as a social worker doesn't really reflect upon your personal biases or beliefs, and that is the second point that I wanted to cover. So for question A on number 4, building personal competency as a practitioner capable of engaging diversity factors for well-being of clients. So I think the most important thing for engaging diversity is to ask important questions. Ask questions related to thinking and actions and conduct related to, in this case, death. How does this individual want to die necessarily? How do they want their family to be involved in that process? What avenues do they want to be taken? How can you help them die the way that they would like, or the way that is, not necessarily want to, but the way that is most peaceful to them and will bring them and their families peace of mind. And then go from there. Your job is to be client-centered and do what the client is asking. And I think it's important to ask questions. What do you want? How is it that you want this to, go down, if you will. In part B, on question number 4, how will you become an ethical leader by increasing self-monitoring needed to identify personal thoughts, patterns, biases, strengths, and affect? So this ties a lot back into what I said earlier, with just asking great questions about how an individual wants their belongings, effects, life to be remembered, conducted near the end of it. But also, I think it takes a lot of talking with colleagues and continuing to learn what your own patterns and beliefs are in this particular realm. Nobody understands death very well, I don't think, and I think it's important to continue to learn, to continue to educate oneself about what is the best way to deal with death, what is the best way to gain insight about the way people want to be treated and the way they want to be taken care of near the end of their life, and what is best for the families of those individuals. Okay, I just wanted to make sure I didn't leave anything out. I don't believe I did. Thank you very much.